Hello everyone, in this video we are going to see about toilet training.
So we'll be having some series of videos in which we will be looking at what are the different levels and how we can do toilet training for children with special needs. This can also be used for other children as well.
Now let us quickly look into the content of this video. Here we are going to see sequence of development or milestones. People will be aware of motor milestones like head control, rolling over, sitting up, or standing and walking. So this is the sequence of motor milestones. So like this, children also have sequence of development of milestones related to this bladder control and bowel control. So it is important for us to know the sequence of such development. Only then it is easy for the caregiver or the trainers to understand the child and to train accordingly. And we will also look at different levels of training. We have 3 levels of training, and we need to understand each level, what are the ways, and for who are the children who will fit into each of these levels, because each child will go under each category of training. So we need to know which particular level the child need to undergo training. We need to understand, so we need to know the development and age of the child, and accordingly we have to choose whichever the level of training. Sometimes a particular child would have already have had normal development in one particular level, in the first level, for example. So that child can go straight away into the second level of trainings. So some children would have developed a first level of training and also second level naturally from the beginning. So those children can go into third level of training straight away. So that caregiver need to understand these different levels of training so that they can choose whichever level is appropriate for their children. And another important note I would like to mention here, this particular method that we are going to discuss cannot be applied for children who have already achieved toilet control and they have lost their ability for whatever reason during their course of development. So for those children, you need to follow a different method. So this method will not be applicable for those children. This particular method that we are going to talk about can be applied only for children who are at early stage of development, who have not had any kind of bladder or bowel control.
We can start toilet training around 18 months. So it takes about 3 to 5 days to 3 to 4 weeks. So it depends on each child and the understanding ability of the child, and also how consistently the caregiver is able to do the training. So we can do bowel training and bladder training. We need to know about these two aspects separately. This can be trained simultaneously or one at a time. So, generally, bowel training can be followed by bladder training because it is easy to start with.
Now let us look at the sequence of development. The first stage is awareness of being wet. Here, the infant becomes aware of being wet. This can happen as early as 3 to 5 months, or it can happen even before this time period. Here, the child or the infant may wake up from sleep being aware of wetness. The next stage is indicating after wetting. So, after the child wets the pant, he or she may start to indicate by crying or by moving away from the place or showing any signs of distress. So, this uh, starts happening around the same time, say 3 to 5 months. Some infants may indicate by crying and moving away, but some may be aware of being wet, but they may not indicate. The next stage is indicating before wetting. That is, even before the child wets, the child is able to indicate. Here, the child has limited control. The sense the child needs to be taken to the restroom as soon as he indicates by pulling his pants or any other method. If he is not taken to the toilet or the restroom as soon as he indicates, he may void. So the next stage is indicating before wetting, and here in this stage the child has better control. So the child is able to wait till he or she is taken to the toilet.
The next stage is indicating before wetting, and the child is dependent. So the child now is able to indicate before wetting when the child feels like voiding, or if he or she has the urge to pass urine or stools. The child is able to indicate but needs help to go to the toilet and also to manage his clothings. The next stage, the child is independent in the sense the child is able to go to the toilet, use the toilet by himself or herself, but needs help for washing. The last stage is complete independence, where the child is able to use the restroom without any adult's help and is also able to manage his clothing, and he is able to wash himself or herself, and he is totally independent in this particular act. So now let us look at the three different levels of training. Level 1 starts with being able to follow regular schedule. So we will be seeing all these levels in detail in the following videos. So here in this level, the child forms association between the washroom and toileting. And next level is level 2, where the child has adequate control and consistent indication. The child understands that voiding should be done only in the washroom. It should not be done anywhere else, or he should not soil his or her pants. So all this understanding comes at this level, and the child is able to consistently indicate and has better control. Then comes the level 3, where the child is completely independent. As we already discussed, the child is able to perform the act without the help of anybody. So, what is level 1? Following regular schedule. Okay, here the child needs to follow a regular schedule. We will see how to make this schedule in the upcoming videos. And here in this stage, if the child is taken to the specific place, the child is able to void. The specific place need not be restroom, because in various culture, especially for children, they do have a separate place in their house or outside. Okay, so you need to select that particular place where the parent or the caregiver wants their child to void. So the specific place should be decided by the caregiver, and if the child is taken to that particular place, and the child is able to void. And in this stage, the child has limited control in the sense that if the child is not taken to the toilet immediately, he or she may void wherever he or she is. So he may wet the pants if not taken to the toilet immediately. So coming to level 2, here the child develops adequate control and consistent indication. Here the child is trained to indicate the need to void. So the child has to learn to indicate his need to use the restroom or that particular place. He can be trained to use verbal or gesture. Assistance is given to use the washroom. The adult or the caregiver is needed to accompany the child. And here the child has good control. He or she can hold till he reaches the restroom or the specific place. And wetting pants happens very rarely. So this is level 2. Then coming to level 3, here the child achieves complete independence. The child is able to open the door and use the toilet. The child is able to manage his pants or his clothes. The child is able to manage cleaning the area, to flush or to pour water, and the child is able to wash himself or herself without the help of an adult. So in the upcoming videos, we will see how a child can be trained to complete each of these levels that we have talked about.
For queries and consultations, you can email us at childcareguidance@gmail.com.